Good evening, everyone, and welcome so much to today's session hosted by Passcode Global Consultants. Can one of you please confirm for me if you can hear me? Please, one of you to confirm via chat if you can hear me. Okay, thank you, Miriam. So my name is Ruth Kariri, and I'm the marketing executive at Passcode Global Consultants. And I'll also be the moderator for tonight's session. So welcome so much. We are going to begin the session right away. So I'll begin by briefly telling you more about us and what we do as an organization. So Passcode Global Consultants is a support and guidance organization, and we assist nurses to pursue international nursing opportunities through pathways such as the USRN and German nursing pathways. So basically what we do, we assist you with Nclex registrations, Nclex training and preparation. We also assist with interview preparation and job search. So tonight's class will be focusing on acid-base imbalances, which is one of the very important topics in the Nclex, and it is commonly tested in the Nclex. So by the end of the session, you will have a better understanding about the topic, how to interpret the question, how the topic is tested on the Nclex questions. And I believe that will be able to strengthen your critical thinking and also how you can be able to answer the Nclex questions. So I won't be taking much of your time. I'm going to invite our tutor for today. Her name is Roselyne. She's an Nclex tutor and expert. She's going to take us through today's session. And without wasting much time, I'm going to invite Roselyne. Roselyne, please, if you can hear me, I'll allow you to take over the session from here. I also want to encourage you to keep your microphones muted. Also, you can ask the questions that you have in the chat box. And please let us stay till the end of the session. We are going to have a Q&A session as well. So if you have any questions, they'll be and any questions on the topic, they're going to be answered in this session. Thank you so much. Roselyne, kindly, if you can hear me, please take over.
Thank you very much, Ruth, for that introduction, and good evening to all of you. I hope you can hear me. Let me know if you can hear me as I present. Just give me a few seconds. In the meantime, please let me know if you can hear me. Also, let me know if you can see my screen. All right, thank you very much for that confirmation. So, as Ruth has mentioned, my name is Roselyne. I'm one of the tutors here at Passcode, and I'd like to welcome all of you to this webinar. Today, you're going to tackle ABGs, a very important topic when it comes to Nclex. And so I believe that at the end of this session, you'll have gained some knowledge. In case you have any questions, any concerns, feel free to ask even as I continue with the presentation. So on to objectives. We're going to do some brief definition of some terms: acid, bases, hydrogen. We'll go ahead, look at some of the causes of ABG disorders. including the management and some of the clinical manifestations. And lastly, I'll be taking you through how to do ABG interpretation. And regards to that, we'll have a bit of questions for you to practice and see if you're in a position to interpret an ABG. So we'll begin. So ABG in full, that is arterial blood gas. Arterial blood gas. And you'll find many patients in the ICU. We rely mostly on this test to check how they are faring on, especially the amount of oxygen that's getting into their blood, because most of them they're dependent on on mechanical ventilator. So pH, this one assesses the acidity or alkalinity. We have partial CO2. We'll talk about this later. That's the respiratory component of the ABG. We have the bicarbonates represented as HCO3. That's the metabolic component. Some instances you may also see PaO2, that is partial oxygen, as well as sometimes they may include the SpO2. So that's a component that shows oxygenation. We'll be talking about them later. Again, still on some of the definition of terms, we're going to look at three terms. We have hydrogen ions. And hydrogen ions, basically, these are positively charged particles that play a key role in maintaining the body's acid-base balance. So usually they're expressed in form of a pH, and when the pH is low, then that means there is acidity, high acidity. When the pH is high, that means there is low acidity. For the acids, they are produced as end products of metabolism that increase hydrogen ion concentration in the body fluids. They contain hydrogen ions and they're known to be ion donors. So more hydrogen ions represent low pH. And then you have the bases. These are substances that reduce hydrogen ion concentration and help neutralize acid in the body. They contain no hydrogen ions and therefore they accept hydrogen. So this is just basically understanding. You're not likely to be tested on this. It's just a foundation for us to understand the ABGs. So where do we draw this blood from? So before you take the samples, usually you have to do some assessment. And this assessment is called the Allen test, the Allen's test. So this is a quick bedside procedure that is done before an ABG, usually at the radial artery, to assess adequate collateral circulation from the ulnar artery. So if you're able to remember your anatomy, you can check and see on the diagram there, we have the ulnar artery, we have the radial artery. So you have to check for collateral circulation. So radial artery this is the one that is commonly used when they want to take samples for ABG. Okay, so let's see how this test is done. So you're saying that you have to occlude one to see if there'll be collateral circulation. So if the radial artery becomes occluded or damaged, that means this ulnar artery must be able to supply blood to the hand. So why do we do this test? These tests, it ensures that the hand won't become ischemic after the procedure. So if you occlude this one or if it's damaged, then this ulnar artery should be able to supply the distal part of the hand. So let's look at the steps when performing this Allen test. So number one, you need to inform the client to clench their fist. That is to empty blood from the hand. And then secondly, you occlude both the radial and the ulnar arteries by applying warm pressure, as you can see on the diagram here. And then after that, once you've occluded and your fingers are still there, you instruct the client to open the hand. So this will appear blanched. Blanched means they become pale. Why? Because you have occluded blood supply both from the ulnar and the radial artery. So after that, you're saying that you release pressure on the ulnar while keeping this one still compressed. So remember, you want to test if this ulnar will be able to supply blood even when this one is damaged or it is occluded. I hope that is clear. So you're going to release this one as you keep this one compressed. So we talk about positive Allen test when the color returns to the hand within 5 to 15 seconds. So remember we said the moment the client releases, it is pale, it is blanched. By the time you're releasing the ulnar compression and you find that this hand regain its color within 5 to 15 seconds, then it indicates that you can go ahead and do your ABG from the radial artery. But it is negative when the color does not return. So that means you cannot use that wrist to take blood for ABG. So I hope that is clear. So should you come across any question that asks about that, then it's important to know what Allen's test is all about. But now for focus today is to look at the ABG itself. This is just a test that outlines if you can go ahead and take sample from that radial artery. So back to the ABGs, we have 4 common ABGs. We have the respiratory acidosis, we have respiratory alkalosis, we have metabolic acidosis, and metabolic alkalosis. So you start looking at the disorders in terms of what causes each and the management. And then thereafter, we'll conclude our discussion by the interpretation. So let's start with respiratory acidosis. So whenever you come across the word respiratory, always note that the problem is coming from the lungs. Whenever you come across the word metabolic, then the issue is with the kidneys. So respiratory acidosis. So here the main cause is hypoventilation. Hypoventilation. So think about any disease that affects the lung directly, or it may affect the central nervous system where breathing is controlled from. So it occurs when lungs cannot remove enough carbon dioxide, hence causing CO2 retention and a decrease in blood pH. So the causes, you must remember them. For the causes is a must remember that. So I said look at any respiratory disease. So we have asthma, brain trauma, pulmonary embolism, pulmonary edema, hypoventilation, atelectasis, pneumonia, use of central nervous system depressants, bronchitis. So examples of central nervous system depressants, you have opioid overdose, sometimes even the sedatives, anesthesia, all those will affect the CNS. Okay. We also have other conditions that affect the neurons, neuromuscular disorder like myasthenia gravis, spinal cord injury. So think about anything that's going to interfere with ventilation, leading to hyperventilation. So the signs and symptoms of the or rather assessment, so it varies depending on the cause. How a client with asthma will present will differ from how a client with pneumonia is. How a client who has brain trauma will differ from how a client with bronchitis is. But all these conditions with regards to respiratory acidosis. So I've just listed some of these, but I've said again, it is dependent on the cause. So you have symptoms like drowsiness, dizziness, disorientation, which show there's some signs of hypoxia. muscle weakness, hyperreflexia, shallow, rapid respirations, okay, difficulty in breathing, headache, dysrhythmias. So I'm not focusing on the signs and symptoms because, as I've said, they differ depending on what is causing that. Again, for management, equally, it is dependent on the cause. But general management, you need, as a nurse, you need to monitor for signs of respiratory distress. Which are some of these signs that may show that a client has respiratory distress? Let me get that feedback from you. List some of the signs of respiratory distress. So difficulty in breathing or shortness of breath, restlessness, use of accessory muscle to breathe, retractions, tachypnea, low levels of oxygen saturation. All those are signs of respiratory distress that you need to look out for. And then part of the treatment also entails administering oxygen as prescribed. Positioning depends on the condition. You manage the underlying cause. So I've said it depends. If the client has pulmonary embolism, the management might be slightly different from someone who has pulmonary edema or someone who has pneumonia. So you manage as the underlying cause. Also encourage deep breathing and coughing exercise. You can administer respiratory medications like the bronchodilators, that in the case of asthma or even bronchitis. And then lastly, you prepare intubation if the CO2 are more than 50 millimeters of mercury. So the take-home message here is on the causes. That one you must remember. That is respiratory acidosis. You also have another one that is respiratory alkalosis. And this one occurs when a client hyperventilates. So you said with respiratory acidosis, they are hypo. With alkalosis, they are hyperventilating and they're exhaling too much of CO2. Hence, it causes the blood pH to rise. Again, we have causes of hyperventilation, and these include fever, we have pain, hysteria, hypoxia, and even overventilation when a client is on mechanical ventilation. So you can think about any of these that can cause someone to panic. Panic attacks are there. Pain is there. Emotional stress is there. So the key one that they normally use is when someone is experiencing a panic attack. So on the signs and symptoms, again, I've said depends with the cause, but generally we have hyperventilation. We also have tachycardia. There may be normal or a decrease in blood pressure, hypokalemia, numbness and tingling of the extremities. In addition, we have hyperreflexes and muscle cramping, convulsions or seizures, increase in anxiety, irritability. And when we talk about the management, again, you need to monitor for signs of respiratory distress. You treat the underlying cause. If a client is in pain, you give analgesia. When a client is experiencing panic attack, what do? You teach them to control their breathing or remove them from whatever is causing them panic. Also, you encourage controlled breathing technique. You provide emotional support and reduce anxiety provoking stimuli. So those are the two ABG disorders under respiratory. So for metabolic, we'll start with metabolic acidosis. We're going to start with metabolic acidosis. So metabolic acidosis, this one occurs, and I said for respiratory imbalances, the problem is with the lungs, and sometimes breathing that is controlled by the central nervous system. With metabolic, the issue is normally has to do with the kidneys. So this one occurs when there is excess acid accumulation or loss of bicarbonates, which causes the pH to decrease. So we have some of the causes, and these include diabetic ketoacidosis, DKA. So what happens in DKA? Usually there is lack of insulin to cause fat breakdown. So that leads to buildup of ketones, and that results to metabolic acidosis. We also have high fat diet, which increases ketone production. We have malnutrition, that is starvation, which leads to fat breakdown. Again, ketones are built up. Renal insufficiency, whereby the kidneys are not able to excrete hydrogen ions. Again, that is the same issue. Severe diarrhea, where there is loss of bicarbonates. We also have excessive ingestion of aspirin. But one thing about aspirin that you need to note is that early enough, it causes hyperventilation, that is respiratory alkalosis. Then as toxicity worsens, then it results to metabolic acidosis. So on the signs and symptoms, one experiences headache, we have a decrease in blood pressure. Again, what I want to say, their signs and symptoms are dependent on the cause, because an individual who has DKA will present differently for someone who has renal insufficiency or severe diarrhea. But just to outline them generally, I've mentioned about headache. We have a decrease in blood pressure. Also, another one is hyperkalemia, muscle twitching, warm, flat skin because of vasodilation. In addition, you have nausea, vomiting, and diarrhea. There is changes in the level of consciousness. For one who has DKA, uh, they're going to get the Kussmaul's respirations. So we talk about the interventions. Key thing is to treat the underlying cause. For example, if it's DKA, we know that we give normal saline, we give insulin. For renal insufficiency, the client may need to undergo maybe dialysis or kidney transplant. Also need to correct fluid and electrolyte imbalance. You prepare to administer IV solution, such as normal saline or even the bicarbonates. So the take-home message for all this, I've said, you need to focus on the causes, because if in case they bring any question, they may bring it in form of a cause. You identify a cause of any ABG disorder. Last but not least, we have metabolic alkalosis. Metabolic alkalosis, this one occurs when there is excessive loss of acids or excessive gain or retention of the bicarbonates. Hence, it causes the blood pH to rise. So we have some causes, for example, dysfunction in metabolism, where we have some disorders that can lead to excessive bicarbonates. For example, a client who has Cushing syndrome. Sanctioning or vomiting is another cause, where there is loss of gastric acid. We have too much intake of antacids also. A condition like hyperaldosteronism, whereby there is excessive aldosterone. We also have excess sodium bicarbonate whenever you give too much of that. And lastly, sometimes even massive transfusion of whole blood. So whenever you're giving whole blood contains something called citrate. So when citrate is metabolized, it forms bicarbonates, which again can lead to metabolic alkalosis. So on the signs and symptoms, again, they're dependent on the cause. But just generally, we have the following: restlessness, followed by lethargy. We have dysrhythmias, tachycardia. We have compensatory hypoventilation, confusion, nausea, vomiting, and diarrhea. We have tremors, muscle cramps, tingling of fingers and the toes. And lastly, we have hypokalemia. Now, on the management, we need to treat the underlying cause. For example, for an individual who is vomiting excessively, then we need to give antiemetics. We may need to discontinue diuretics if they are contributing to fluid and electrolyte loss. You may need to stop overuse of antacids. So we are saying treat the underlying cause. In addition, also you can give IV fluids to restore electrolytes such as normal saline and even potassium chloride. You can administer potassium, and remember, for potassium, you have to monitor the patient keenly on a cardiac monitor so that you detect any arrhythmias that may arise. And then lastly, you need to institute seizure precautions. Let the patient also be on a cardiac monitor. So some of the management, what I've said, it just depends on what is causing this metabolic alkalosis. Now, we want to move further to look at the interpretation of ABGs. Let's look at the interpretation of ABGs. And we have key parameters that we need to know the normals so that we're able to appreciate the abnormals. So we talked about pH, we talked about CO2, we talked about bicarbonates, and these are the normals. So the normal pH is between 7.35 to 7.45. That is a must know. You don't have to be given, you must remember. CO2 ranges between 35 to 45. So if you can remember pH, then the decimals for both forms the CO2. And then lastly, we have the bicarbonates, whose normal is between 22 and 26. So the normals are very crucial for you to know. Whether you're given or not, you must know. So when we talk about acidosis, this is when the pH is less than this. We talk about alkalosis, this is when the pH goes above this. Equally for CO2, when it's less than this, we talk about alkalosis. When it's more than 45, we talk about acidosis. For bicarbonates, when it's less than 22, we talk about acidosis. When it's more than 26, we talk about alkalosis. So this thing I want you to remember, and every time you are doing your interpretation, always have this. You can have it in the form of a table, or you can have it written somewhere. I'll be showing you exactly how we use this information. Now, I've said that you have two main organs that are used to control or regulate the pH. We have the lungs and you have the kidneys. So when someone is experiencing respiratory disorders, then the kidneys, they come in to compensate. When an individual is experiencing metabolic disorders, then the lungs, they come in to compensate. Now, just again to echo, I said for respiratory ABGs, they originate from the lungs, whereas metabolic disorders, they originate from the kidney. Now, I want us to go through the interpretation of ABGs. So you have to ask the following questions. Number one, does it show acidosis or alkalosis? Number two, is the cause respiratory or metabolic? And then thirdly, is it compensated or uncompensated? So we'll start as we build on these three steps. We'll start as we build on the three steps. So again, I'm just going to highlight the normals. I've said for pH, ranges between 7.35 to 7.45. Anything on the left side, acidosis. When the value goes on the higher side, alkalosis. Again, for you to mention whether it is acidosis or alkalosis, we base it on the pH. So pH is our guiding factor. And then for the CO2, we have between 35 to 45. When it's lower than 35, that is basic. When it's more than 45, that is acidic. And then lastly, we have the bicarbonates, 22 to 26. Less than 22, acidic. More than 26, basic. So in addition, we normally have the SO2, that is for oxygen. So we have partial oxygen level, and then you have the SpO2. The normal SpO2 is that you normally put a pulse oximeter. When it's above 95, that means the client is oxygen levels are good. The other one is for the PO2, supposed to be above 80. So the range is between 80 to 100. For the other three, I've already mentioned about it. Now let's go through the steps of ABG analysis. So question number one, you ask yourself if the pH is normal. Talk about normal pH, it must range here. If not within this, then where is it lying? Okay, but first question, ask yourself if the pH is normal. Second step, ask yourself if your CO2 is normal. If it's normal, then it's going to range here, 35 to 45. Third step is to find out if your bicarbonate is normal. If it's normal, it will range between 22 and 26. So already you have these three parameters and you've analyzed them to know if they are normal or abnormal. Now, step number 4 is very crucial. Why? Because it matches what is abnormal to the pH. It matches. I'll be showing you what you mean by matching. Underline the word matching. Where does it lie? Does it match your pH? Is it acidic? So you're going to see the meaning of the word matching. We'll do an example. Step number 5, does CO2 or bicarbonates go on the opposite direction of the pH? And lastly, if you're given the PO2 or the SO2, if they are normal, okay? But in many instances, you may not see this. Mostly you'll find the CO2, the pH, and the bicarbonates being presented to you. Now let's use an example that I introduce that aspect of matching. So the question reads that analyze the ABG. Analyze this ABG. You've been given pH to be 7.22, PCO2 of 49, bicarbonates of 26. So you're starting small as we grow, okay? Starting with an easy one and then you'll grow from there. So step number 1, I said you have to look at all the parameters. You identify if they are within normal range. So let's start with pH. Is your pH normal? I'll be asking you as you respond. Is our pH normal? So our pH is not, it's not within the normal range. So it's not within the normal range. What about our CO2? Our CO2, is it within the normal range? Our CO2 equally is not within the normal range. What about our bicarbonates? Is it in the normal range? Our carbonates is within the normal range. So that is the first three steps that you've already done. Now, personally, what I normally do, I normally write them down. You can choose to draw a table, you can choose to write. So you start with your pH. You said it's between 7.35 to 7.45. And when it's on this side, it is acidic or acidosis. When it's on this side, it is basic or alkalosis. So you keep writing until it gets uh, able to remember it. And then you have PaCO2, that is 35 to 45. What is on this side, it is basic. But on this side, it is acidic. That means when it's more than 45 is acidic. And then you have the bicarbonates, 22 to 26. When it's on this side, it is acidic. Whereas when on this side, it is basic. So every time you have a question, always do this. Always write this. So that when it comes to matching, you'll see now what I mean by matching. Now, we say that our pH is abnormal, it's not normal. So where is it lying? Where does it lie? It is less than 7.35, meaning that it is on the acidic side. And I told you that the pH is what gives you the name, either acidosis or alkalosis. So now that it is less than 7.35 and is on the acidic side, then we'll end with acidosis. Our final name will be acidosis because of the pH. The pH is the one that gives acidosis or alkalosis. We move to CO2. So we are looking for something that's going to match our pH. That means whatever is matching acidic. So let's look at PCO2. Our CO2, where is it lying? Where is it lying? It is above 45. So it's on this side. Which side is that? It is acidic side. Does it match your pH? Your pH is acidic, whereas your CO2 is acidic. So they are matching. And I say, whenever they match, that gives you the problem. So the problem is respiratory. And I say, whenever you have CO2, the problem is respiratory in nature. If bicarbonates are the ones that are matching, then the problem is metabolic in nature. I hope that is clear. So, hence the name respiratory acidosis. So, if you go to bicarbonates 26, we say 26 is normal. So, it doesn't incline in either side. Is that well understood? So, we're yet to get to compensation. I said you're starting small as you grow with it. Okay? As you add more on that. So, again, I'm going to go through this once again. First thing I said is to identify all the parameters, if they're within the normal range or they're outside the normal range. And if they're not within the normal range, where are they? And we started with the pH. Our pH is 7.22. We are given this as the normal. So you can see 7.22 tends to be less than this. So where is it lying? It's lying on the acidic side. And I said the pH is what gives you the final name. The final name here is acidosis. Okay? The second thing is to look at the CO2 and the bicarbonates. They match acidity. So if it matches the acidosis, then that is whatever holds the problem. But the one that's not matching, then it doesn't have a problem. It could be normal or it could be compensating. Okay? So in this case, Our bicarbonates are normal, so there's no issue with that. But our CO2 is more than 45. And when it's more than 45, it tends to incline towards acidic side. And I say you're looking for something that matches your pH. And you can see these two are matching. Hence the name respiratory acidosis. Is that clear? Is that clear? I'd like to hear your feedback on that before I proceed to another example. Okay, so I can see a majority of us say it's clear. Someone's asking about what about the CO2, the HCO2. The HCO2 is normal. The normal is 22, 26. So if it's within the normal range, you don't bother about it much. We're going to do another question. We'll do several until it's home. So this pH is that we're given is 7.34. PCO2 40, bicarbonates 21. The same thing I said, we start by checking if our parameters are within the normal or not. So let's start with pH. Is our pH within the normal range? Our pH is not within the normal range. What about our CO2? Is it within the normal range? Our PO2 is within the, our PCO2 is in the normal range. What about our bicarbonate? Is it within the normal range? Our bicarbonates are not within the normal range. So again, as usual, I said, keep writing until you get it right. So pH, the normal is 7.35 to 7.45. When it's on this side, it is when it's less than that, it is acidic. See the way I'm writing, you keep writing this, even if you know it in your head, keep writing it because the matching bit requires you to see it physically. And then on this side, it is basic or alkalosis. And then you have CO2, which is between 35 to 45. When on this side, it is acidic. Whereas on this side, it is basic or alkalotic. And then you have the bicarbonates, 22 to 26. Whereas on this side, it is basic. But in this side, it is acidic. Okay. So after you have these parameters written down, you come and check what you have. Let's start with pH. Our pH is 7.34. Where is it lying? It is less than the normal. It's less than 7.35. So why is it lying? It's lying on the acidic side. And I say the pH is the one that will give you the final name. In this case, our final name will be acidosis. The pH is the one that gives you the name. It's less than 7.35, so it is acidosis. Let's move to the next parameter, CO2. CO2 is normal, so we have no issue with that. We move to bicarbonate because you have to match. We have to match whatever is matching this acidosis. So bicarbonate is 21. 21 is less than this. This is the normal. So that means it's on the acidic side. So as you can see, this is matching this. Hence the name metabolic. Metabolic acidosis. That is the ABG. Any question? Is it getting better? Anyone who still has a challenge in this? Someone is asking, how do you determine if metabolic or respiratory? How do you determine if it's metabolic or respiratory? Remember, I said if the problem is CO2, it is respiratory. If the problem is bicarbonate, then it is metabolic. So whatever is matching your pH is the problem. Whatever is matching the pH is a problem. So in this case, whatever was abnormal was 21, and it was bicarbonate. So bicarbonates are the problem, and this is metabolic. Remember, we started by defining some terms. We went ahead even to look at the two key regulatory for ABG. And I said you have the lungs and you have the kidneys. Okay? So whatever matches your pH, whatever matches your pH is the one that has a problem. So if the bicarbonates are the ones that are matching, then that is the issue. Okay? I know there are so many ways of doing this. There are so many ways of arriving at the answer. If you have your formula of doing it and it has been working for you, that is okay. I'm trying to help someone who has or has never gotten the grip of this. So this is just one way, and I find it very easy, even without cram. You don't have to cram. As long as you're able to know this, then you don't need to cram anything else. You don't need to cram which direction they are going. As long as you know the normals and you confirm with what you're given. Let us do another uh, example. We're still doing basics. We are yet to get to the compensatory. After this, we'll go to compensatory. We'll make it more complex. But you have to get which one has the problem, okay? So let's look at this one. pH 7.45, PCO2 24, bicarbonates 25. I don't know if I should give you a minute to tackle it before we go through it together. Now let me give you a minute to do this. So let me get your feedback before we go through it together. I believe you have somewhere you're writing. So we are yet to introduce the compensatory bits. So I just want you to put it blank. And then after this, now we introduce the bit of compensation. All right, so let us tackle it together. The question was, I want you to interpret this ABG. You're just doing it as a basic without giving the compensatory bit of it. So as usual, we start by identifying the parameters if they are within the normal or not. That's the first step as always. So you start with your pH. Is your pH within the normal range? The answer no, it's not within the normal range. What about your CO2? Is it within the normal range? The answer is no, it's not within the normal range. What about bicarbonates? Are they within the normal range? The answer is yes. One thing I want to mention, sometimes you may find that the bicarbonates are not within the normal range. Okay? But I said you're starting small as we grow. So until all of us are able to get this basic, whereby you're being given at one parameter that is normal, that is basic, it's not complex, where one parameter is normal. So as usual, you write the ranges, pH 7.35 to 7.45. I say we don't get tired of writing this until it sticks, because it will help us to match. Okay? So when it's less than that, it is acidic. And when it's acidic, then it gives the acidosis name. When it's more than that, then it is alkalotic. Next, you have the PCO2, where between 35 to 45. So I said anything that matches your pH is a problem. When it's more than that, it's acidic. When it's less than that, it's basic. And then you have the bicarbonates. So remember, if this is the one that matches, then the issue is respiratory. If the carbonates are the one that matches, then the issue is metabolic. Okay? So you have 22 to 26. Anything less than that is acidic. Anything more than that is basic. Okay? Wherever matches your pH is the problem. So let's start with checking where our pH lies. 7.45. Where does it lie? 7.45. Where does it lie? This is the normal range. Definitely, it is above 7.45. So that means it is alkalosis. So you write the last name, alkalosis. The next thing, you want to identify if it is metabolic in nature or it is respiratory in nature. You want to check if it's metabolic in nature or respiratory in nature. And how you tell that is the one that matches. In this case, you're matching alkalosis. We are matching alkalosis. Now, PCO2 of 24. PCO2 of 24. Where is it? It's less than 35. So where is it lying? It's lying on the basic side. So definitely already seeing that this CO2, which is respiratory in nature, is matching our alkalosis. So it is respiratory alkalosis. Okay? Respiratory alkalosis. Finally, you have your bicarbonates, 25. 25 is within the normal range, so it doesn't have an issue. Is that well understood? Who still has a question, a challenge in arriving at the answer? Because from here now we want to move to the bit of compensatory. Who has an issue with this? I've said there are various ways of doing it. If you have your way of doing it and is working well for you, stick to that. If you find this one interesting and easy to work with, well and good, as long as you all arrive at the answer. Anyone who has a challenge? Okay, so I want to twist this a bit. I just want to change something slightly, but it will change the whole thing. So pH 7.54, PCO2 of 54, and then bicarbonates of 30. Bicarbonates of 30. So I want you to hold that thought somewhere because you're going to introduce something called compensatory. But even before I introduce that, what do you think what would be the ABG interpretation for this? pH 7.54, CO2 54, bicarbonate 30. What's the interpretation? Let me give you a minute to do that. Keep your answers coming. Keep your answers coming. That's the only way to confirm if this is well understood. Okay, so let us look at this together. So I've said you're not tackling the aspect of compensation for now. I just want you to make it a blank ABG interpretation, basic. And if you've been following the way I'm writing the pH, the CO2, and matching, then you'll not be able to fail. Okay? But if you've not done that, then chances are you'll not get it. So don't ignore this thing that I'm writing. Whenever I write this, it's not because I don't remember it. It's because it's going to help me with matching. is going to help me with matching. And if you cannot do this, then you're likely not to get it correct. You're likely not going to get it. If you don't do this, you're likely not going to get this question correct. But if you write this, then you get it correct. The matching is the issue. Don't look at the figures, look at what matches. So pH 7.5, 7.35 to that. CO2, 35 to 45. I've said on this side, it is acidic. On this side, it is basic. If you don't write this, you'll not get this question correct and you'll not get any ABG. You'd be doing guesswork. Bicarbonates, 22 to 26. On this side, basic. On this side, acidic. If you don't write this, I've said you'll be guessing. So let's start. We want to get the final name. The final name is obtained from the pH. Our pH is 7.45. Where is it lying? It's more than 7.45. So it is alkalosis. So you write alkalosis. Okay. The next thing is determine if it is metabolic or respiratory in nature. And I said the issue has to match your pH. So if the issue is CO2, it is respiratory. If the issue is bicarbonates, then it is metabolic. Okay? So let's start with CO2. Our CO2 is 54. Where is your 54 lying? Please answer that. Where's your 54 lying? Is it on this side or on this side? Where is it lying? The 54 is lying on the acidic side. Does it match your pH? 54 is lying on the acidic side. Does it match your pH? It does not match your pH. So it's not the problem. It's not the problem. So don't pick on it because I've said your pH is the one that guides you to what must match it. So your pH is alkalosis. Your CO2 is acidic. They don't match. So you don't settle on that. Okay? You move to the next one, bicarbonates. Bicarbonates, you've been given 30. Where is 30? 30 is above 26. 26 is on the basic side. Does it match your pH? Your bicarbonates, they are matching your pH. So the problem is metabolic in nature. So you have metabolic alkalosis. Metabolic alkalosis. So some of you will be asking, why is it now that this one is 54? Now the CO2 is coming in to compensate. Okay? It's coming in to compensate. And that's what you want to go and discuss next. But without writing the bit of compensation, then this is metabolic alkalosis. Are we together on that? So I can see quite a number of us, we got this correct, apart from a few. But for those ones who are not able to get it, I hope now you understand. We're not just looking at the numbers, but we're looking at what is going to match the pH. Is that well understood? Anyone who has a challenge in that? This is a webinar, it's free for you to understand this well. So if you still have something that is confusing, something that's not clear, please feel free to ask. Someone is asking, what do you mean by matching the pH? Matching the pH means that alkalosis matches basis. Acidic matches acidosis. It matches acidic. So in this question, we started by saying our pH is basic or alkalotic. So whenever you're looking for the other two that are remaining, they must be either basic. So CO2 is acidic. It does not match this. Whatever is matching is this bicarbonate, which is basic. So alkalosis is another name for basis. Okay? Alkalosis or basic. So you're saying that you look for something that is matching this pH. Someone is asking, when do we say that respiratory acidosis, given that the CO2 was acidic? So remember here, if you want to put this as respiratory acidosis, if you want another question where the answer would be respiratory acidosis, then the pH has to change to be acidic. Remember, I said the pH is what gives you the final name, whether it is acidic or basic. So for you to say acidosis, then the value must be less than 7.35. Okay? The value of the pH must be less than 7.35. In this case, you have 7.54. It is more than this. So it's on the basic side. I don't know if that is clear. So if I change the pH, if I did change this pH, if I change this pH to 7.24, this name will change. This name will change to what? Respiratory. It will be, let us just do it together. So our pH is 7.24. It is less than 7.35. So it is acidic side, okay? Hence the name acidosis. We've just altered with the pH alone. The rest of the things are remaining the same. The next thing is to look at the CO2. Our CO2 is more than 45. It is 54. It is acidic. And our pH is acidic. So we are saying that these two are matching. So you have acidic on the pH, you have acidic on the CO2. So the name changes to be respiratory acidosis. Lastly, you have the bicarbonate 30. 30 is basic. So you cannot go for 30 because your pH is already showing you that whatever is causing is acidic in nature. Is that clear? So they can always alter. A small change in one of the parameters gives it a new name because all that you are doing is to match your pH. So if it is 7.24, it is acidic. Your CO2 is 54, is also acidic. So it is matching your pH. That's why you're going for respiratory acidosis. Is that clear? Any more clarification, any more questions on that? I hope I've not confused anyone further. So let me just get feedback on this. If it's clear, let me know. Good. So I can see that at least a good number of us, this is well understood. Now introduce the final bit that is on compensation. So I've said there are various ways of doing all this. I will not be giving you the shortcut of saying which goes which direction. Personally, you've seen how I present my interpretation. So if you be following through that breakdown, then for me, I'll not give you which goes which direction. I am not conversant with that. I just present the facts as they are. But there are so many shortcuts of doing it. If you want to maybe to be acquainted with that, you can always check that out. But if you've been following the breakdown, then you should not be cramming anything on what goes where. You just match and you write the normals. Now, having known how to interpret a basic one, now we want to introduce the compensation. So we have three types of compensation that we'll be looking at. The first one is uncompensation. We have partial compensation. And then lastly, we have fully compensation. So I'm going to give you a shortcut on how you can remember this by telling you in this and this what are the abnormals. But first and foremost, you must know how to interpret. You must know the basic. What you've been doing in the last 30 or so minutes is the mainstay. Because after this, we're just adding the name partial or fully or uncompensated. But you must have the interpretation with you first. So let's start with uncompensated. In uncompensated, the pH is always abnormal. And then either CO2 or bicarbonate is normal. So you're saying that one of these will be normal. One of these will be normal. One is normal, the other one is abnormal. A good example is this. pH is always abnormal. You can see it is abnormal. And then one of these is abnormal. So in this case, the bicarbonate is the one that is abnormal. Our CO2 is normal. That is uncompensated. But the mainstay remains. You must interpret the way you've been interpreting. So let us interpret. I know the answer is there, but just to help us arrive at the answer, I said always write your parameters. pH 7.35 to 7.45. This one's very easy for you to remember, but the moment you introduce this aspect of alkalosis on the side, then it makes your work easier when it comes to matching. This bit helps you when it comes to matching. And then CO2, 35 to 45. And so on this side, it's acidic. On this side, it is basic. And then you have the bicarbonates, 22 to 26. On this side, it's basic. Whereas on this side, it is acidic. So I've said for also all of us, we know the normals, but when you write on this side, on the sides, it helps you to match. So let's start with our pH. pH 7.47. Where is it? You can see it is above 7.45. So it is alkalosis. So the end word for our ABG will be alkalosis. The next thing you want to find out which one matches alkalosis. Say it's either alkalosis or basic. Those are two synonymous. CO2 of 37, it is normal. So there's no issue with that. Bicarbonate of 32, where is it lying? It's lying on the basic side. So it's the one that is matching your pH. So it is metabolic. metabolic alkalosis. But now we want to introduce the compensation aspect of it. And I've said when you want to write about uncompensated is when your pH is abnormal, and you can see that is true. Either means one of them is normal. In this case, our CO2 is the one that is normal. So this one makes it satisfies the name uncompensated. Nothing has started working on this. Uncompensated metabolic alkalosis. Uncompensated metabolic alkalosis. So the CO2, that is the lungs, they are yet to start compensating for this. Okay? When they start working to compensate, we'll find that the CO2 becomes abnormal as well. And that takes us to the next one, which is partial compensated ABG. Is this well understood? So previously you have encountered several of them that were of this nature. We have encountered several of them that were uncompensated. So let me just go back. For example, this one, it was uncompensated, right? Because the pH was abnormal, the CO2 was abnormal, the bicarbonates are normal. So you can see one of them is normal, so it is uncompensated. If I may go back to this one, the pH is abnormal, the CO2 is abnormal, it's normal, sorry. The bicarbonates are abnormal. So again, you can see one of them is abnormal. So again, the name uncompensated. And the last one was this. The pH was abnormal. The CO2 was abnormal as well. And the bicarbonates were normal. Hence the name uncompensated. Okay. So I've said you're going a notch higher to introduce the compensation bit of it. So this is the first one. Is this well understood? So either is abnormal, then you talk about uncompensated. Is this clear? Now let's move to partial. Let us move to partial. So in partial, all the three parameters are usually abnormal. All the three of them are abnormal. The pH is abnormal, the CO2 is abnormal, bicarbonates are abnormal. Okay? And I've said you only introduce a bit of compensation after you have interpreted your ABG. You only introduce a bit of compensation after you have interpreted your ABG. So we're going to start by interpreting this ABG. We start by interpreting the ABG before we introduce the aspect of compensation. So pH 7.34. 7.34 is less than 7.35. So it is acidic. So we'll finalize with the word acidosis. Okay? pH gives us acidosis. Next thing is to look at what the problem is, where the problem is. And the problem must match your pH. Our CO2 is 50. 50 is more than 45, and it's more than 45 is on the acidic side. Does it match your pH? The answer is yes. So the acidic in the CO2 matches your acidosis in the pH. So CO2 is a problem. So we have respiratory acidosis. But you want to introduce the aspect of compensation. Why are we not taking on the bicarbonates? Bicarbonates of 29. 29 is more than 26. And when it's more than 26, it becomes more of basic. It becomes more of basic, yet our pH is acidic, so they are not matching. Okay. Now that you have respiratory acidosis, you want to introduce that bit of compensation. And I've said for partial compensation, you'll find all of them will be abnormal. pH is abnormal. CO2 is abnormal. Bicarbonates are abnormal. So you'll find that it will be partial compensated respiratory acidosis. Partial compensated respiratory acidosis. That is the full name. Okay? So what is happening is that the kidneys, which are represented by the bicarbonates, are trying to compensate for this excess CO2 that is built up in the blood. Is that well understood? So the full name here is partial compensated respiratory acidosis. Is that clear? Any more clarification on that? So I've said starting point is to analyze the ABG, and then you finalize by introducing the aspect of compensation. Okay? So up to this point, respiratory acidosis, are we all clear up to there? Up to getting this respiratory acidosis as our ABG, are we all uh, able to do that? I want to get more feedback. Good. So this aspect of compensation, I've said, the moment you have analyzed your ABG, now you want to introduce a bit of compensation, you ask yourself, or you look at the parameters, if all of them they're abnormal. If all of them are abnormal, that means your pH is abnormal, your CO2 is abnormal, your bicarbonates are abnormal. Then you talk about partial compensation. So what is happening here? Remember your problem was respiratory, but these bicarbonates, of which they are metabolic, that is kidney related, so the kidneys are coming in to help get rid of the excess CO2. That's why bringing the aspect of partial. Why partial? Because our pH is not yet back to normal. Yes, they are trying, the kidneys are trying to correct it, but it's not yet there. Because when it's fully compensated, then our pH will become normal. In this case, you can see it is still slightly a bit outside the normal. So you talk about partial. Yes, something is happening, but not quite. Now, the full one is when now the pH has gone back to normal. So for fully compensated, we talk about pH being normal, and you know the normal is between 7.35 to 7.45. And then the two parameters, they remain to be abnormal. Remember, there's a problem somewhere. One of them is trying to compensate to a point that it has brought the pH back to where it was supposed to be. Now, most of the students, they don't understand why or how we come about the name full. So this pH is normal, as you can see, but there's somewhere it was coming from. Okay? There's somewhere it was coming from. So again, as usual, you must write these things down. 7.35 to 7.45. CO2, 35 to 45. Bicarbonates 22 to 26. And I said it doesn't end there. You have to include what happens when they move to either side. When they move to this side, it is alkalosis. They move to this side, it is acidosis. This side is basic, this side is acidic. This side is basic, this side is acidic, okay? So I want to bring the aspect of full. But as usual, you start by analyzing. Analyzing remains the same. So let's look at our pH. Our pH is 7.45. What is it? It is normal. By that, it will give its name full, but you're yet to go for that. What you need to ask yourself, where was it coming from? Where does it tend to lie on incline? So if you were to put a line in between here, you're working with the pH. If you were to put a line to divide this, do you think your pH is coming from this acidic side or from the basic side or alkalotic side? Where is it coming from? Where do you think? Where is closer? Another name for that. Is it closer to 7.35 or is it closer to 7.45? It is closer to 7.45. This is somewhere it's coming from. It is coming from this side for it to return back to normal. If it's on the acidic side, it will be abnormal trying to come back to normal. Okay? If it's coming from the acidic side, it will be 7.3, 7.22. Anything below this to be coming from this side. Okay? If it's coming from the alkalotic side, it's coming from an abnormal value trying to get closer. So ours, which is 7.45, is closer to this, meaning that the problem was alkalotic. The problem was alkalotic. So we have alkalosis. Okay? Before we continue, if the pH was 7.36, if the pH was 7.36, it is still within the normal range. But where was it coming from? It's coming from the acidic side. I hope you're able to see. It is normal, but where was it coming from? It is coming from the acidic side. If you have 7.43, it is on this side. 7.44, it is on this side. Okay? 7.45 is still on this side. So it's coming from the alkalotic side. So the final word will be alkalosis. Now, the next thing you want to check if it is metabolic or respiratory in nature. By that, you have to match alkalotic. CO2 of 30. CO2 of 30 is less than 35, so it is basic. And this is the one that matches our alkalosis. So it is respiratory alkalosis. But now we want to introduce the word compensation. The only time when you can use fully compensation is when your pH is back to normal. And in this case, you can see our pH is normal. So the complete word will be fully compensated respiratory alkalosis. And that is the full name. Someone may ask, why not metabolic? Metabolic, our bicarbonates, we have 19. 19 is less than 22. So it will be more of acidic. But remember, our pH is alkalotic. Okay? Is this well understood? Is this well understood? I'd like to receive some more feedback. Anywhere where you need some clarity on. All right. So I can see a majority of you have gotten it well. So we want to do a couple of questions and I'll be giving you uh 2 minutes. Okay? I'll be giving you 2 minutes. In the process, we'll be revising and you'll get it more clearer. So this is the question. So here you're giving me the full name, including the compensation bit of it. So your pH is 7.15, CO2 46, bicarbonate 34. I want to give you 2 minutes. You give your answer. Make sure you do it because only by doing it, that is when you're able to see where your weakness is, especially if you're having a challenge in it. Okay? Okay. Let us do this together. Let's do this together. So you remember the rules? You say that if everything is abnormal, then that's partial. If pH is normal, that is fully. If pH is abnormal, but either CO2 and bicarbonates are abnormal, then it's uncompensated. But before we get to compensation, we have to interpret the basic ECG itself. So as usual, you write your pH, that it helps you when it comes to matching. I will not get tired of writing this, and I hope you don't get tired also from your end of doing this. So this is alkalosis. This is acidic. And then CO2, 35 to 45. This is acidic. This is basic. Bicarbonates of 22 to 26. This is basic. When I say it's basic, I mean when it's more than that, it's basic. When it's less than that, it is acidic. Now let's start. Our pH is 7.15. Why is it? It is less than 7.35. So it is acidic. Hence the name acidosis. Okay? So up to there, I hope all of us we had acidosis. I don't see anyone with alkalosis, so that is good. Step number 2, is to check which has the problem, which is the problem. Our problem has to match your acidic. Let's start with CO2. CO2 of 46. 46 is more than 45, so it is on the acidic side. Already I can see our CO2 has already matched our pH. So this is respiratory acidosis. Why not bicarbonates? Carbonates is 34. 34, it's more than 26. And it's more than 26, it becomes basic. So it will not match our pH. So we don't settle for metabolic. Now, the aspect of introducing compensation, I said when your pH is abnormal, your CO2 is abnormal, your bicarbonate is abnormal. We talk about partial compensated. So this is partial compensated respiratory acidosis. Partial compensated respiratory acidosis. From the feedback, I can see great answers, and that makes me happy because I can see that you're getting it. Okay. So I just want to check on a different one. Yes. Again, I'm giving you 2 minutes to give your answer. Not to this one. Just a minute. I look for another one. Yeah, I want you to tackle this one. Okay, so for the interest of time, let us go through the question together. You can still continue giving your feedback. So again, I'll just do the stepwise as always, 7.35 to 7.45. On this side is alkalosis. When it's less than that, it is acidic. Then you move to CO2. The normal is 35 to 45. On this side, it's acidic. On this other side, it is basic when it's less than 35. And then you have the bicarbonates, that is 22 to 26. On this side, it is basic, whereas on this side, it is acidic. So normally we start by interpreting the ABG before we introduce the compensation bit. So our pH 7.45, it's normal, but where was it coming from? It was coming from this side. So we'll have alkalosis. Our PCO2 is 48. 48 is more than 45, which is acidic, but we want something that is alkalotic or basic. So our CO2 does not match our pH. So that's not the problem. And then you have the bicarbonates, 28. 28 is more than 26, and it's more than 26, it's more of basic. So it is matching our pH. So we have metabolic alkalosis. Now, to introduce a bit of compensation, I said you look at the following. If your pH is normal, then you talk about fully compensation. So our pH in this case, it's normal. So this is fully compensated. Metabolic, not respiratory, metabolic alkalosis. Metabolic alkalosis. So for those of you whom you're picking on respiratory, it still means you still have a challenge with matching because our CO2 is 48. 48 is more than this. And when it's moved on this side, it is more of acidic. Yet your pH detects it's supposed to be basic. So you don't settle for that. All right. So whatever has the issue is the one that matches the pH. In this case, it is bicarbonates. I hope that is clear. I can see quite a good number of you got this correct, and I'm happy about it. So I think by now I'm gonna stop at that. The ball is on your court. You can go do as many examples as you can, as long as you have the basic knowledge on how to go about it. You can always play around with the figures. So allow me to end it at there, and I take it back to Ruth. Ruth, are you there?
Yes, I am Roselyne. Thank you so much, Roselyne. We are honored to have you take us through today's session. And I hope every one of you has learned something from today's session. I want to thank you all for staying very engaged throughout today's class. Just to remind you that acid-base imbalances is a very important and it's a commonly tested topic in the Nclex exams. So I would love to hear from you. If you've found the class helpful, you can type to us on the chat. You can tell us how you think the class has been. Has it been helpful? If it has been helpful, you can let us know. You can give us feedback. We value feedback from you. And just to remind you that our Nclex June intake is open. So if you'd like to join us for a comprehensive 4-month revision Nclex program, please WhatsApp us or call us via the numbers I've shared. And just to remind you that we also offer comprehensive support on Nclex registrations. So from transcript analysis, CGFNS application, all the way to exam booking, we are here to assist you with that. Also languages, IELTS, OET, and PET preparation. Passcode is here to support you throughout the whole USRN guidance. So I want to let me see if you've written your feedback on the charts. I can see Belinda is saying it was very educative. Thank you. Florence says Roselyne has made it very simpler. It's good to hear that. It's been very educative from Maureen. I learned something new. Though I missed the beginning. Maureen, we're going to share the recorded version of this session tomorrow in the WhatsApp group. So if you're also not in our WhatsApp group, kindly join our WhatsApp group so that you can be getting updates whenever we have webinars on the Nclex or USRN journey. You can be getting one-on-one updates. Roselyne, I think the class has been very, very good, very educative. I want to thank you once again. Eva Karagina is saying so helpful, especially on the compensation. You're welcome, Josiah. You're saying the experience is good. I'm so happy to know that you've enjoyed the session. And if you're here and you've not joined Nclex, our Nclex program, please WhatsApp us or call us via the numbers I've shared. If you missed the number, here's the number, +254 791 126 717 or +254 726 311 477. And we are going to guide you. We are going to take your consultations regarding Nclex and the USRN process. So feel free to reach out to us. Thank you so much. And I think we can call it a class. It's been